It's my pleasure to be here today. And I also want to say from my side, I believe this is going to be really a challenging but a wonderful 3 days to experience. Why do I say that? Now, just before you go, I haven't got children, unfortunately, because of cancer and chemo. But I've got 3 brothers, so I think I know males and men. And I can tell you, that's why I'm such a fighter for women's rights. Okay, but let's see. It's my privilege to tell you, and just to give you some background, why did we decide to go this route? Why did we decide to go with women's health and this research conference? And first of all, I want to refer you back to the comprehensive cancer control guidelines that we've got from the WHO, World Health Organization. And that is, the aim of cancer control is to reduce incidence, morbidity and mortality of cancer, improve the quality of life in cancer patients in a defined population, through a systemic implementation of evidence-based interventions for prevention, early detection, diagnosis, treatment, and palliative care. It's got to address the whole population and the needs of all different subgroups at risk. So I believe if you look at this control guideline, we try to address all these issues. And why do I say it, if I can take you back? We're looking at awareness, coping and beyond. Yes, first day we're going to concentrate on cancer in your homes. And why we're doing it is to see what can we do to reduce the risk, the awareness issues around those. The second day we're looking at cancer in our bodies. And specifically here we're going to look at early detection issues and ways and means to treat people effectively or to be aware of what to do by women. And lastly, but not the least, is survivorship on the last day. What do we do beyond cancer? The day you were diagnosed. And as I am a survivor myself, I can tell you, for me, this is a very passionate issue. Carl and I just come back from overseas, from America. We went to a conference on survivorship and research. And it's fascinating to see what they've been doing for the last 10 years, for the first time ever, long-term complications in survivorship. And we're going to discuss that in the last days. We're going to look at certain complications and so forth. But to come back to it, why the subgroup women? We know that in our country, 52% plus of the population are women. We also know that women are the most illiterate, much more literate than males. We further know that we have got this burning issues around, especially around breast cancer and cervical cancer. And we know the incidence of cervical cancer is the highest amongst black women, especially in this country. And both these cancers, the incidence is growing by the day. And therefore we believe it's the right time to actually address issues around women's health and women's cancers during this month, while we always have a biannual research conference, as you know, and we thought this would be appropriate to do. Just to sum up, according to the World Health Assembly in 2005, they said, to make it very plain, prevent what's preventable, cure what's curable, relieve pain and improve quality of life, and manage for success. And again, I want to refer you, that's what we're looking at all the time. And also in our own organization, we need to make sure that we avoid the risk that we can. We need to address carcinogens and other issues that could impact on cancer incidence. We also need to look at promoting health wherever possible. And early detection, very important, as you know. I've added and rehabilitation there, as you can see, under relief pain and improve quality of life, because in accordance to the research now done on survivorship also need to be focused on rehabilitation. Why do we have rehabilitation plans and programs in place for cardiac patients? Why do medical aids pay for rehabilitation programs for cardiac patients but not for cancer patients? These are the issues that we will be addressing the last day and when we look at the way forward. And more so, of course, we must manage for success. We must always measure what we do and look at outcomes. And I'm just going to end it off here to say, knowing is not enough, we must apply. Willing is not enough, we must do. Very wise words spoken long time ago. But we need to know it's not only for listening, but what are we going to do about the things that we hear? What are we going to do when we go back to our organizations? How are we going to make a difference in the lives of so many people out there? We've got a responsibility, and we need to do so together. We need to take hands, because that is what life is about. We need to fight cancer as partners. Thank you for being here.